Well, hello, and welcome to Pharmacotherapeutics, Nursing 6015. I'm Dr. Kathleen Muglia, and I'm so excited to be teaching you this course this semester. I have been a nurse for about 30 years and have been administering, prescribing, and assessing the effects of medications for quite some time. I've been teaching this course for a little bit, a few years, many years. And I love teaching students about medications and safe medication administration. This course is so much more than just studying drugs and memorizing adverse effects. You will learn how to assess the patient to make sure that you're administering the right medication. You will figure out how to assess for adverse effects. Many medications can cause very serious adverse effects. And although we're trying to help patients by giving them medications, ultimately a medication can be deadly. So we need to be very careful. So here's my top 10 tips of how to be successful in pharmacotherapeutics. A lot of nursing students think, oh my gosh, I'm going to have to memorize 300 drugs, and I just don't know how I'm going to be able to be successful in this course. So number 10 is how to contact me. As your professor for this section, I want you to ask questions. Not only want you to ask questions, but I expect you to ask questions. So contact me. Email is best at kathleen.muglia@marquette.edu. I will return emails within 24 hours during the week, within 48 hours over the weekend, usually quicker than that. But if you don't receive a reply from me within that time frame, please email me again. I must have missed it or failed to hit send. Human error can occur. So please don't think that I am ignoring you, but please send me another email. We could meet over the phone. We can meet over Teams in video. We can meet if our schedule allows in Pleasant Prairie or in Milwaukee. Number 9, have fun with this course. As I shared in the introduction, there's many different things you need to be thinking about when administering medications, but it's one of the tasks that nurses need to do that requires a very high level of thinking. And it's not just that opening up the package and handing a pill. And so enjoy that. There are many fun ways to learn, so try and have fun with the course. Remember that your success is our goal. And so we have embedded many different fun learning activities like Jamboards and Flipgrid videos to engage you with the material. You will learn from me, your professor. You will learn from the other 3 professors in the course. We will share discussions weekly. We will be rotating. So you are welcome to attend any of the professors' office hours, discussions, etc. If you have specific questions about your assignments, I will be grading those, so contact me. Number 8, study every day. There is a lot of content in pharmacology, and you don't want to start studying for your exam a couple days or even a week before. Think about our weekly synchronous discussions as mini exam reviews for that module. Think about your daily studying. Yes, daily. It's much better to study in small chunks than study for 12 hours at a time. Number 7, organize your life. There's many different ways in which you can overload your mind and get stressed out, and that can lead to decreased retention of information. So whatever you need to do before you start this course, get it organized. Tell your loved ones that you will need time to study for these courses. You should contribute about 9 hours at least to this course per week. So that is doing your readings, listening to the mini lectures, doing your assignments, that all counts. But make sure that you're giving yourself enough time every single day. Number 6, read. Many students have been able to get away in their undergraduate courses or even a previous master's with not reading the text, but you do need to be able to read and comprehend what you read and use your active learning guides, your reading guides, your study guides to guide your reading. So you don't just want to sit there for 3 hours and then not remember what you read. Really read with intention. And your books are phenomenal. Your Farm Made Easy, your CART, and your ATI books. Think of your ATI book as your Cliff Notes for the course. Number 5, study aloud. Pretend that you are teaching your dog about this medication, and you need to teach your patient everything there is to know about this medication in 2 minutes or less. What are the most important? So you're not going to go through like you hear on the radio commercials or TV commercials about 1,000 different potential adverse effects. And then who would ever even want to take this drug after hearing all that? You want to tell the patient what are the most common and the most serious to look out for. Number 4, your ATI resource is phenomenal. Your Farm Made Easy is phenomenal resource. So spend some time and go through all the different engaged learning activities that you can, because it's a wonderful, wonderful resource. Anytime that you can engage with the material instead of just passively listening or reading, you will increase your retention. Number 3, the syllabus. The syllabus is my contract with you, the student. And so please read through the syllabus, not once, not twice, read it through 3 times, make sure you understand it. And if you have any questions about it, now is the time to ask. Number 2, when you are studying pharmacotherapeutics, the first time you're learning about the medications, you want to study for understanding. Understand what is happening in the body with these drugs. Understand why it is causing the reaction that it is. Is it the intended effect? Is it the adverse effect? Think about the receptors that it's acting on. And when you get into the course readings, you'll understand what I'm talking about here. And memorize second. You will be probably bombarded on YouTube if you Google how to study pharmacology. They're going to give you lots of different cute little ways to memorize drugs, which is fantastic because there is some memorization, but you want to understand at the receptor level first what's going on, and then you can memorize. And lastly, number 1 is study within the classifications of the medication. So instead of thinking about this course as you need to study 300 drugs, you're going to study them within classifications. So there's antimicrobials, the antibiotics in that group. There's different medications for the heart. Within that is ACE inhibitors, for example, like lisinopril. And then look at the suffix. And many of the drugs within one different classification will have the same suffix, like pril, lisinopril ends in pril. That we know then is an ACE inhibitor. Or a SON is a steroid, hydrocortisone, prednisone. So you want to look at the suffix and think about what is common about the drugs within that classification. Now, it's going to take us a few weeks and a few modules before we get into that, but I want to ease your mind on you're not going to have to memorize tiny, tiny details of 300 drugs and not have any way to study them within classifications. So, for example, like I shared, the lisinopril is an ACE inhibitor that we use for blood pressure to decrease hypertension, and we'll give you the pharmacodynamics and pharmacokinetics about this medication, and we'll also give you ways to remember the adverse effects, like give them an ACE and they'll cough in your face. That is the most common adverse effect that is benign. It's not really causing a problem, but a lot of patients will have this annoying cough. So it's something that every patient you have that has been prescribed lisinopril, you will need to tell them that if you develop this cough, it's not harmful, but you may want to let your provider know. So that's just a snippet into the course. Hopefully I have alleviated some of your fears. If you have them, I want you to have fun with the course, how to get a hold of me, how to think about studying all these different medications, how to get prepared, organize your life, plan your your meals, your calendar, use your colored pencils, all those different things, so you can set yourself up for success. Because remember, our goal is your success. Have fun. Bye-bye.